Hi, welcome to the Jewish Orthodox Women's Medical Association podcast. I'm your host, Elisa Minkin. I'm a pediatrician, and I'm joined today by another pediatrician that I'm super excited to have all the way from Israel, Dr. Dina Zimmerman. Hi. Can you hear me?
Hi.
Hi, thank you so much for joining me.
Yes, I can.
Give a little bit of your background information. Dr. Zimmerman, MD, MPH, IBCLC, and for people who don't know what those mean, of course, medical degree, you have a master's of public health, which is awesome, especially in the context of what we're going to talk about today. And you're also a lactation consultant, which is super cool. You right now work as Director of Maternal, Child, and Adolescent Department of the Public Health Services in Israel's Ministry of Health. So I asked you today, and I thank you so much for working this out with me, including the 7-hour time difference, to talk about what we can learn from Israel, because Israel is the world leader in COVID vaccines at this moment in time. Am I correct?
Per population, I think that is correct.
Right. Well, we're not talking about numbers.
In other words, percentage of the population, I think that is correct.
Right, because we're not talking about numbers. Yes, America has put more vaccines in numbers of arms, but in terms of percent population, and I have the data in front of me. I just want to give people some background, and then I'll give you a chance to give us answer some questions. In terms of percent fully vaccinated, I think the United States is somewhere in the 40 to 50% range, and I think you guys are closer to 60 and up percent. But by age, and I think this is what's really important, because everybody knows that the older you are, the higher risk you are, particularly for severe cases of hospitalization and death. And that's what's really important. Israel right now has over 90%, I believe, of their population above the age of 60, which is the highest risk population. And I think 99% above 90 from what I just read recently. And if you look at the data from the CDC, we have only for the highest risk they give, 75 and up, less than 68%. And also 65 to 74, and only 40.6 of age 50 to 64 are fully vaccinated. So that's not nearly the same thing. And unfortunately, we're not in the same position that Israel is. So I'm going to start with, there's been an article going around saying that on Thursday, Israel said they had 0 deaths that day. That's been big news.
Yes, and it was very exciting.
Very exciting. Baruch Hashem, we should go from strength to strength. And we should get some of that love here too. So does Israel have herd immunity?
Okay, so the truth to answer that question is that nobody can answer that question,
right,
because we are talking about a new virus that we are learning as time goes on. And we know that how much percentage of the population has to be vaccinated to get herd immunity changes from virus to virus, okay? Because if we're talking about something like polio, it's enough to have approximately 85%. But if we're talking about measles, we want closer to 95%. So we don't know what the story is with this virus. However, there is no question that the more people that are vaccinated, the harder it will be for the virus to find an unvaccinated person to infect and propagate. And that is why we're seeing such amazing changes over the last couple of weeks in terms of the reduction of the number of cases that we're having, in terms of reduction of the R, in terms of reduction in the percentage of positive cases that are gotten. And it's been very dramatic. It happened at first as we were still in lockdown, and as we are slowly but surely coming out of lockdown, and these numbers are still staying low, that's the first sign that it has to be the vaccines, okay? Because with the various waves of the virus that has been going on over this past year, there have been other times that countries have gotten low and everyone thought like, okay, we're done. And then you wait a couple of weeks and whoop, we're back up. And most of the times, each wave got bigger and bigger.
Right.
And this time, we're opening up, we're back in school, we're without masks outside, and the numbers are still staying nice and low. They're not 0, but they're staying nice and low.
Right.
I think the other thing that needs to be taken into consideration with, are we totally out of the woods, has to do with the issue of the variants. At the moment, it seems that for the British variant, which has come here to Israel and is very popular, the vaccine is still holding its own, but there still is a fair amount of concern about other variants, significant variants that may make a difference. And that's why there's a lot of effort to try to have some degree of control about the number of people that can enter the country, that nobody can just come into the country without being tested, with all the difficulty that might cause. But it's because really keeping an eye on the rest of the world and realizing that the virus is still going crazy in many parts of the world. And therefore one still has to be cautious and
Right.
take things one step at a time.
Right, especially where you're located, right? Because Israel may be doing great, but the surrounding countries.
Yes, and not
Right.
only the surrounding countries. I mean, we have
Everywhere.
people that come from all over the world, and many of those places where people are coming from are in the middle of very, very, very significant outbreaks, such as India.
Right, India was what comes to mind. I mean, India right now, what I'm reading, has having this double variant, very infectious, very scary outbreak. And from what I understand, they had tamped it down a lot through, various control measures. I mean, everybody hates to hear the word lockdown, but they were doing a lot of good public health measures to keep it down. And now it's skyrocketing once they opened up, without adequately vaccinating.
Right. And I really think that is what shows the biggest strength of the vaccination, is that the lockdown is opening up and the numbers are still staying down.
Right. So it really is a race, between virus and vaccine. And unfortunately, we can see more variants if we have more spread, and hopefully we'll see less if we have less spread. So what are you seeing in terms of hospitalizations? We mentioned before that death rate was 0, but what's the overall trend as opposed to that one day for deaths?
Okay, so the overall trend is we're talking single digits. We're also talking about, a number of hospitals are closing their corona wards. And on a step-by-step basis, we're up to approximately 1,700 active cases at the moment, and less than 150 significant, severe cases. So we're talking about so much lower numbers than we were just 2 months ago. It's exciting.
It is amazing. Now, do you have problems with people saying, I don't know why I would have to wear a mask if I've been vaccinated? Because you mentioned you're not wearing masks outside, meaning you were still wearing masks in indoor public places, I presume.
Yes, because even this is a very effective vaccine. It's holding up to its initial pre-marketing promise of being approximately 95% effective in a real life. But 95% effective means that 5% are not, okay? And there definitely are, 1 out of 20 people who are vaccinated, if exposed, may come down with the disease. So if you're still keeping in place public health measures to decrease the chance of their being exposed, then you're minimizing the possibility that it could happen. In other words, for the virus to spread, it needs to find another susceptible person. There are 2 ways to minimize finding that susceptible person. One is to make that person not susceptible, which is the vaccine. And the other one is to minimize the possibility of spread. And the masks have definitely been shown to make a difference for that. We did take a step forward in terms of saying you don't need it outside, because there's a fair amount of evidence that shows that when you're outside, the movement of the air and stuff like that helps, okay? When you have a really, really high amount, it's not good to rely just on the air, but as the numbers of potentially infectious people goes down, it was felt that we could take the plunge, go one step further, but we are definitely still stressing the importance of doing it inside, of wearing it in school, because one of the challenges that Israel faces more than any other country is 1/3 of our population is pediatric.
Right.
Okay. So if 1/3 of our population is under 18, so only slightly less of that is under 16, and we're only vaccinating from 16. So we have a very large unvaccinated population as of now. And yet another thing that is showing that the vaccine is being effective is that within the low numbers that we're seeing, the age group that is having the highest amount are the 12 to 16-year-olds.
But those you should be able to get soon, right? Because Pfizer is working on an EUA for.
We are waiting for the FDA to approve it. Okay, the decision was made that it will not be used until it has official FDA approval. In the background, there's definitely work being done that when the approval comes through, we will be prepared to give it out. But I think in the meantime, we're seeing what a difference it makes, because that is an age group that still is, having outbreaks, that is still able to infect other people. They move around a lot. Okay,
Right.
so they're definitely spreading it. So even though we have younger age groups that are not immunized, they tend to go to school and come back. They're not going around with all their friends in the afternoon, also to the mall and all kinds of activities. So it seems to be a particularly important age group for us to make a difference. And we get to that point, maybe then we really will be able to be more at a herd immunity, but we're approaching, we're in the right direction.
Right, which is amazing, We're not saying that you can get there without the children. I've heard people say that. I'm very skeptical about that. I mean, I know that originally we were saying, oh, we don't see it in kids aren't spreading it, schools should be open. And I think the B117 variant alone has put a big dent in that argument, because at least what I see as a pediatrician.
Yes, no, I totally agree with you, because even before we had the variant, we did a real study of what was going on in Israel with the kids. We had at that point, like over the largest amount of kids in the entire world. If you took all the reported cases in the country, in the world, at that point in the literature, it reached in the meta-analysis about 47,000, and we were doing analysis on 80,000. And in that analysis, it was very clear that kids can be infected and can infect others. Yes, less than other ages, but definitely not in clinically insignificant amount. And they had a tendency of infecting others their age. They could also affect adults. They could also affect younger siblings. Depends a lot on different parts of the population, who they were exposing. But especially with Israel also is very unusual in the size of its families. Okay, we are so far above the OECD average. We're just a bump. That it makes a difference, okay? Because if you go home sick, you have a lot of people that you are potentially exposing. So, it's also true that the kids get less sick than adults, but nevertheless, we're talking about, 500 hospitalized cases. We've had, lo aleinu, somewhere between 8 to 10 deaths. And I say it's somewhere in that amount because it's a little, some of the cases, did they die because of COVID or did they die of something else and they just happen to have that in addition? But it's somewhere in that, amount. So you can't say that there is no mortality, because there is. And there are also kids who were significantly sick during the vaccine. During with the virus, and the people who got sick because afterwards with the post-infectious syndrome,
inflammatory, and also they're saying in our country is a lot bigger, so we have a lot more people getting it, a lot more children getting it. We've had 292, I believe, cases of children who died, and again, how many of them had underlying conditions and, like you said, didn't die specifically because of COVID. They had other things and also had COVID. We have to be honest and transparent. I don't have that data in front of me. It is a very low risk to children, but it does exist. And
it does exist. I brought this up because of the discussion about immunizing children. Okay,
it's
important. I do think when we are able to immunize children, it is important to immunize children for children's sake, because there can be complications of this disease. And if it's a vaccine preventable disease, why not prevent it with a vaccine?
Right. So what we're going to have to do is prove that the risks of the disease outweigh the risks of the vaccine. So it hasn't been studied yet adequately.
Well, to some degree,
under
it
12
has, because We know how many kids have gotten seriously ill from the virus, at least here in Israel.
Right.
And we do at least know that in the pre-marketing tests that were done by Pfizer, there were no significant side effects to date. Okay. So we are so I can already tell you the numbers are more. How
Right.
much more we'll have to see when it's a lot more people, but it was not an insignificant amount of kids that were tested with the vaccine. Okay, there were about 4,000 kids tested, 2,000 kids actually exposed to the vaccine, and it had an efficacy of 100%. Okay, and
It's
without any,
amazing, which is really amazing. But I think people are going, it's going to have to get an emergency use authorization. We can't use it
exactly.
until then.
But we do something. But I think in terms of thinking, should one be considering it when it has it? I think it is fair to say, as you were saying, the risk of the disease, which we know,
Right.
okay, which is not, it's less than adults, thank goodness. As pediatricians, I say that.
Right.
But it is not non-existent, and it really looks like it's more than the disease. And even some of the things about the vaccine that could it cause, like a storm of your immunization.
Right. Cytokine
well,
storm,
that's
right.
exactly what the disease does.
Exactly.
Okay, that's so it's like, I don't think it hasn't been shown from the vaccine, but even if it's there on a theoretical level, we know it's there from the disease.
Right. And the fear of this has been promoted by people, who are trying to scare people from the vaccine. This whole antibody dependent enhancement fear was something that was talked about theoretically based on the previous SARS vaccine, but has not been shown to happen with this vaccine. End of story. No. And yet it's easier to scare people than unscare them. And it's very important for people to make a rational risk benefit decision when it comes time for children and right now for themselves. So a lot of people are saying, why should I get this vaccine? I'm young, I'm low risk.
Because it is not a non-negligible risk, even if you are low risk and you are young. I mean, we definitely have a bunch of 20-year-olds who have gotten, very significantly ill. There has been some mortality in that 20 to 30 range, okay, which looking at it from the other side is also young.
Right.
And it's not this disease is not a joke. Okay. And therefore, if it's at a point that it is vaccine preventable, then the risk benefit ratio that you talked about really makes sense, towards the vaccine.
Absolutely. And what about pregnant women in Israel? What has been the approach of Israel? Because I know here the CDC, brand new news, finally came out recommending it. Before they were hedging and they were saying, talk to your doctor. They shouldn't have it withheld, but they weren't recommending it. And again, that's because it hadn't been studied specifically in pregnant women.
When the vaccine first got its emergency authorization in December, Israel was not, for a week, said it was not going to give it to pregnant women. Within that week, the American Association of Obstetricians and Gynecologists came out saying that could be used. There were also the equivalent organizations in Israel didn't see a real problem. So it then went through a series of updates of the recommendations to at first that it was permissible. Certainly if you were in a high risk situation. I mean, that was the first change, because we have a large number of pregnant doctors who were working in hospitals, and it really seemed that the risk of them of contracting COVID was far greater than any theoretical risk from the vaccine. So at first it was like permitted, and then it was just for high risk people, and then it was like, okay, anyone can get it. And then in January, around January 8th, if I remember correctly, there were a number of cases of obstetric deaths of pregnant women. Okay, and then it became recommended. So at this point, the vaccine is recommended for pregnant women. It's the way it is written is a little fuzzy about the first trimester. Okay. Just because they couldn't get absolutely everyone across the board to exist. But the way it's written and the way that I explain it is if you work at home, have no other children, and don't go out shopping, and you want to wait till your second trimester, you can. But if you have contact with any other human beings,
Right.
okay, then it probably makes sense for you to have it even in your first trimester. And we've had no, now we've been doing this now for what's it, like 3 months. So we're talking already about hundreds, if not thousands, of pregnant women who have gotten the vaccine. And we are not having any, reports of any problems in that population. That's certainly one that we'll look at further in depth as we get the data in a way that it can be done. But it theoretically is not a problem. And in practice, this does not seem to be a problem. And even more so for breastfeeding women.
Right. The potential
There never was any logical reason on the face of this earth to say that it should be an issue in breastfeeding women, because there's almost no vaccine in the world that we don't give.
Right.
With the acceptance of like yellow fever. And in terms of the mechanism of this vaccine, it made no sense. And in fact, if anything,
you're getting static here as you go. For some reason, you're getting static here.
Okay, I'm sorry, we don't have the best underlying mechanism. Can you hear me a little better now?
A little bit better, yeah. Stay close to your microphone, please.
Okay.
That's better.
I was saying that with the breastfeeding, that the vaccine is most likely to even help the baby, because if some of the antibodies come through the breast milk, well, that's only going to help the baby against, corona. So pretty much we're giving it to all lactating women, and very much encouraging pregnant women to get the vaccine. I think we also have to remember there are a number of other vaccines that we encourage pregnant women to get. Okay, right. We want women to get their flu shot. We want pregnant women to get the pertussis vaccine. So this is not the first vaccine that has been given specifically to pregnant women. And in terms of its underlying mechanism, okay, and the fact,
I'm sorry. You're staticky. Sorry. I want people to hear what you're saying.
Is this any better?
It's better. Thank you.
Okay. So I was saying that in terms of the mechanism, on a theoretical level, this vaccine should even be safer than the vaccines that we already give, which are, you have a protein. Here you don't even have a protein.
Right.
You have a recipe for the body to make its own. So.
Right. Which in a way is more natural if you think about it that way. This fear that somehow natural. People are, it's easy to scare people, it's genetic, it's gene therapy. It's not. And that's the funny thing about
it. It can't get into natural. It can't change.
Right. We keep saying that. And it may end up being the wave of the future for vaccines, but because it's new, it's scaring people. And down the road, people may go, well, how did they ever do it the other way? Like, this is so much more natural for the body. Just here's the recipe, like you said, go do it yourself.
Right.
So I think that's really, really important. So it is not true that Israel is not allowing it during the first trimester, right? Because that was something that people asked us. Is it true that Israel is forbidding the vaccine in the first trimester?
Absolutely not true.
Thank you.
A pregnant woman can get it at any point that she wants.
Right. And like you said, it is a risk benefit. Some people are, we during our April 11th event, we had Dr. Richard Grazi, who was saying that he often will not encourage it in the first trimester. And the reason he doesn't is because these are people who have worked hard, through fertility treatments to have a pregnancy. And they said if they lose that pregnancy, even if it has nothing to do with the vaccine, because that does happen frequently, they will never forgive themselves. And so try to isolate themselves and be especially careful during that first trimester. That could be anybody's choice, presuming that they can, but say a nurse or a doctor who's working with COVID patients is just much greater risk of getting COVID, which is definitely not good for the fetus. I don't know how much we know about that specifically, but we've definitely heard, bad things happening later in pregnancy to both the mother and the baby. And I believe that it was one particular case in your country, one very sad case.
We had 2 cases. We had a case of a mother dying in childbirth with her fetus apparently infected, and another case of a late stillbirth where the baby was apparently infected.
Right, right. And we definitely, don't want to hear or see more of that. I know that especially later in pregnancy, there is
Mhm.
definitely a greater risk for a pregnant woman with COVID, just to herself, let
Yes,
alone to her
right.
baby. And I do believe that we do have studies showing that when you give it later in pregnancy, that the baby that is born with antibodies. Correct me if I'm wrong, or if you're not sure, somebody should go
I've
double
seen it
fact check
more with the
this.
breastfeeding. I saw it more with the breastfeeding than I saw it with the thing, but it's possible.
Yeah, I think these are new.
But whatever it is, yeah.
Right. The people who say we're guinea pigs, there's this like cartoon that shows mice in a cage and they're saying, I'm waiting for the human trials for the vaccine. In other words, the humans are guinea pigs. Well, it's true. This is a new vaccine and we are using it with less time to go by than we would have for other vaccines because COVID is killing people every single day. Right. We're in the middle of a deadly
And
pandemic.
also because that's, there are a couple of reasons that this vaccine has been used so fast. One of it is because of the urgency of the need for it,
Mhm.
but part of it has to do with the amount of international cooperation that there has been. Okay, so it's not that it's really been tested on less people, it's been tested on more people than many other medications have been tested, but they were able to get to that same number of people faster, A, by doing it in a bunch of different countries simultaneously, and B, because the disease is so rampant.
Right.
If you're busy trying to test out a measles vaccine and your chances of having measles is, 1 in 1,000. Well, till you get enough measles cases to know if the vaccine makes a difference, then that it takes time. But if you're talking about something that you're talking about thousands of cases that this person is going to be exposed to in his community, then it's easier to do it faster.
Right. And we have a lot more data now as people are taking it than we did at
Right.
the very beginning. We have millions and millions of people who've
Which is why I think that it's understandable the degree of fear in December when it was new, but I think now when we have so much data on post-marketing data, it's very reassuring, and therefore, no one is the first person to do this anymore.
right. And we
You
have
know?
no evidence either from animal studies or for people who've had it so far that it causes birth defects or any damage to the fetus. On the flip side, though,
That is true for the vaccine, okay?
yeah,
And so far with the virus, it's only, it's only been around for a year. So the number of women that actually were infected in their first trimester who then went on to give birth is not that great.
right. Well, that's what I was about to say about the
Um,
vaccine. It's the same thing for the vaccine. So
right,
again, it has to be weighed. We cannot lie and say we've got so much data. It's 100% safe. First of all, nothing's 100%. It's you're balancing the potential
right.
risk
Even
against
water.
actual risks. And in terms of long-term risks, I can't tell you how many people have asked us, I'm concerned about the long-term risks. I will not get a vaccine that hasn't been around for 5 years or 10 years or whatever. All right. The thing about COVID is, again, we only have the COVID long-term effects for like 2 years, right? Or whatever it is, but we're seeing them and they're not insignificant. And that's what's also coming out now is a significant percent of people who had COVID, even young, otherwise healthy people, are having long-term effects. They're not over it
Mhm.
yet. And so that's what it has to
Correct,
be weighed
correct.
against. People are
But
so,
we know that long-term effects of the
yes,
disease,
people who
and we're
are
not seeing
autoimmune,
long-term effects
this
of it.
appears to be affecting your, autoimmunity from acute to long term. The disease itself does. So I don't understand why we fear theoretically the vaccine when we have the virus so common, so prevalent, right in front of us with that threat, which is a real threat and a common threat. It's not a rare threat. It's not just the cold,
Right,
you know.
no, no.
So I think that that's
And we're seeing that once again in children. We have there's, looking at one clinic that is starting now to deal with kids with long COVID. So there are at least 80 kids who are signed up for that clinic. That's not so, and that's just one clinic. That's not
right.
insignificant.
Right. And you've got a small population. They're saying here, they're reporting as much as 15% of children have long-term effects that they know of. And I
Mhm.
tell you, in my practice, we are required to see every child 5 and up 2 weeks after to see if they are really recovered, how severe the illness was, putting aside the multi-system inflammatory, which we've seen some of. So it's
Mhm.
not the most common thing. They're often asymptomatic or mild, but the risk to the child himself or herself should not be poo-pooed, especially because if you say to someone, well, I want your child to be vaccinated to protect the most vulnerable, a lot of people are going to say, don't you throw my child under the bus. So
you're protecting your child. I think one of the other important things is that many of the multi-inflammatory cases were actually in children who had very mild cases.
right. It's just unpredictable.
Just right. This virus is very unpredictable. If there's one word to describe this virus, it's unpredictable.
Right. So we're making risk-benefit decisions with tremendous uncertainty, and we have to come out and straight and say that we're not going all hashtag vaccine here, and we're not telling anyone to get the vaccine. People who are criticizing this organization for JOMA for pushing the vaccine, we are not pushing the vaccine. We are giving information. You make your choice. You talk to your healthcare professional. You make your choice. We just want the good information to be out there, because you know what they say, a lie goes halfway around the world before truth gets its pants on. I'm probably ruining that quote, and I don't know who said it. But, you know, misinformation travels virally, and good information, not so much. It's very frustrating. So what do you know about the variants in Israel? I think you said that you're seeing the B117, tons of it, and it seems to be doing well with the vaccine. Are you seeing the South African strain?
We're seeing a little bit of the South African, and from what we've seen, it is also being protected by the vaccine. The other things, such as the Indian one, just starting to see now. Right. It's recently that Israel has gotten an organized system put in place to be able to test the variants. So we're going to know more about it as time goes on.
Right. And I want to put it out there. I don't know if you...
In other words...
I'm sorry.
Good.
I was going to say, I want to mention this, that somebody sent me a supposed study that shows that people in Israel who got the vaccine are 8 times more likely to get the South African strain. And what it was based on is a misinterpretation of a report of breakthrough cases. So I think we have to be clear that getting the vaccine is not 100%. You've said it already. So this was a report of 400 breakthrough cases, and 8 of them had the South African strain of those who are fully vaccinated, which doesn't mean the vaccine doesn't work. It means it happens, right? And most of the time, the vast majority of the time, it's milder, which is what we're trying to do: prevent hospitalization, severe disease, and death, not eradicate the disease off the planet. Halavai, we should do that, but that's not a realistic goal, at least now. And they compared it to a control group where only 1 had the South African strain. So they made this 8-to-1 ratio.
That in itself doesn't prove it, because you would need to know what the frequency is of the South African in that community, which we don't necessarily have all that data at this point.
Right. And if
just because there's...
Yeah.
There's also a lot of variation within Israel, even though it's a small country. When we're talking about variants, if one person brings it in from another country and spreads it in one city, it may take some time before it gets to other cities, depending into which community it was brought. So that study does not mean it's not necessarily working.
It's rather than interpretation. That's not science, first of all, to say 8-to-1 just because of a rare variant being more prevalent in one group than the other. But it also makes sense that if the South African strain is more resistant to the vaccine, and that's my understanding, that you will still be... You will have reduced vulnerability, but not as much as for the original COVID or for the B117, that British variant. It is more resistant to some degree. So it would make sense that in a group of people who broke through, they would be more likely to have the South African strain, not because they're more vulnerable to it, but just because that's the strain that they have less resistance to. Does that make sense? Right. So it's not selecting.
Yes. And once we go back again, once we have more people who are vaccinated and we're still wearing our mask and all those kind of things, then we will hope that it can't be spread.
Right, and this also, they're planning on
be spread.
That as we're trying to stay ahead, the vaccine companies are trying to stay ahead, and that word booster is misleading, as it sounds like they're just giving you more of the same, but this would be to help you resist these new variants. Again,
right, which is one of the beauties of the mRNA technology, that you actually can make changes like that relatively quickly.
Right. So Another piece of misinformation, and I'm going through pieces of misinformation, and I want to find out, by the way, the second part of this question is, how are you guys handling vaccine hesitancy? Because we need a lot of help with that here, because as many people who want the vaccine have gotten it, we're getting to the point where people are just not getting it because they don't want it. And some of them will never want it, and that's just is what it is. But other people are just scared. And so I would love to hear what Israel did. But before we get there, there is a myth that all these people in Israel are dying from the vaccine. So can you please enlighten us?
No one is dying from the vaccine.
Right.
We are keeping track of all people who have died within a month of vaccine, and there is no peaks that we're seeing, more so than you would expect a certain amount of 90-year-olds to die over the course of the month without anything else. So we are really not seeing deaths that are related to the vaccine. But we are really seeing how we are seeing less deaths because of that, the vaccine.
Right. You have 99% of your 90 plus population vaccinated. Every single day, unfortunately, people of that age will die. And they've been vaccinated.
Right. Right? So it seems much more to be tied to the natural cause of death and not to the vaccine. And the vaccine is definitely making a difference in terms of our mortality, as you said at the beginning of this.
And you have an amazing computerized system. So one thing that makes Israel so strong is the way you're able to track everyone.
Yes, every single positive case is in a centralized database.
Right. So how did you deal with vaccine hesitancy?
I mean, like all vaccine hesitancy, it's an ongoing process. I think that part of it is that the numbers are speaking for themselves, that for many, many people, A, they're seeing that it's making a difference. B, they're seeing as more and more doses are being given, it does not seem that terrible things are happening. Like, once again, I can understand the hesitancy more in December than now, because you're talking about 6 million doses that have been given within the country, with very, 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 low significant complication rates. So I think that's one of the things that helps. I think it's also very important to do things like that. I think people have to be able to honestly raise their questions, ask their questions, and have their questions answered. Okay. So we've had a number of conversations with the school system, with a number of schools, with parents in the schools, trying to ask whatever questions people may have. And I think that's the best that one can do. It's not easy, it takes time, but it's important. And you can spread good news by person to person too. So it's a matter of lots and lots of explanation.
Right. I mean, that's what we're trying to do ourselves, is just to have lots of, information and answering questions. We've been answering hundreds of them. We're trying to be as honest and transparent as we can, with no agenda other than good information. So I'm hearing a lot here of talk about upcoming mandates. That's in America. We're under emergency use authorization, so nothing's happening that fast. And I actually am hoping to talk to a lawyer who specializes in vaccine law. So I'm not going to put you on that, obviously, but a lot of people are talking about Israel's green card, and they're sort of comparing that to a mandate. So can you explain what this green card is? And
right. Well, I think Israel will not force people, for better or for worse, to be vaccinated against anything. Okay. We don't even have forced immunization to be able to go to school, unlike many states, Okay. So, however, what the green card is more a reward for people that vaccinate, rather than a punishment against those people that don't. And that's why there's a big difference between essential services, such as going to the doctor, to the hospital, to school. Okay. In none of those places are we using the green card as a requirement to get there. On the other hand, for places such as hotels, party halls, where it's not a absolute essential need of life, it's felt that we are going to reward the people that are vaccinated by giving them greater
Really
options.
staticky now. It's hard to hear. Super hard. I'm sorry.
I'm sorry. We're trying to give the people.
I'm so sorry. It's so frustrating.
We're trying to give people options to get what they need. Okay, so you are not forced by law to vaccinate, but if you do vaccinate, you have benefits.
It makes so much sense to me. I mean, America right now is super polarized, and it's not to our benefit. It really is not to our benefit. I mean, I personally do not want to see people being forced. I want them to have good information so they can make their own decisions and have that autonomy. I think it's so important, and it's a balance, right? It's a balance between autonomy and fighting a pandemic, you know, having the right for your own health decisions, but, you know, not harming anyone else by the result of that health decision, right? So it's a challenge, and I think if approached properly, I think Israel is doing an amazing job, and I think that's one more thing that we can learn from, like you said, make it be a privilege, not keeping anybody from, like you said, essential services because of it. Because people are saying, "Oh, we're going to be second-class citizens." You know, we've got a, you know, two-tier state here or something like that. And so that doesn't sound like that from what you're telling me.
No.
Which makes a lot of sense.
I mean, I think a number of those same fears, a lot of those fears were expressed here, but that is really not the way it came out. Okay, it really came out that you're not being forced, you're being rewarded.
Right. I mean, listen, whatever you do can be warped into a different way to, you know, spread a certain message. But we're here today, like I said, just to give facts. Right? People can take them, you know, and hopefully hear them and make a good decision for themselves. Anything you want to add? Because I think we went through a lot, and I say kol hakavod.
I guess maybe to show that there can be a light at the end of the tunnel. Okay, that it is possible, but it requires, you know, community cooperation in terms of vaccinating when one is able to vaccinate. And it also requires, you know, cautious optimism, one step at a time, not just thinking, oh, it's all over, let's go back to everything before. And I think that's the main message that we're learning from this.
Right, and that's what we all want. We just want to get back to life as we used to know it. And I'm hoping
or better.
Right, or better, right? But God willing, Mirza Hashem, we will get there. We just, like you said, have to be patient and take it one step at a time. And I thank you so much for doing this with me, all the way from Israel.
My pleasure.
Thank you.
You're welcome. Laila tov.
You too.
Bye.